Iron deficiency, a frequently missed diagnosis in women. Hi, I'm Dr. James Meschino. You know, with severe iron deficiency, people get anemia. So that means that they have a low red blood cell count, or there's a change in the red blood cell shape, or the hemoglobin content in the red blood cell is really low. You see, iron is required to make hemoglobin, so an iron deficiency leads to anemia. So if you have lack of iron, then hemoglobin isn't going to form properly. And because hemoglobin in the red blood cell is the part of the red blood cell that transports the oxygen to your body tissues, then you run into trouble. So the signs of iron deficiency anemia include things like excessive fatigue, because there's not enough oxygen getting to the tissues, and decreased appetite and a very rapid heart rate, shortness of breath. Hair loss can occur, really cold hands and cold feet, a sore tongue, easy bruising, brittle and sore nails, and other symptoms can occur as well. My point is that there are many women who, during their childbearing years, they don't have a severe iron deficiency that leads to anemia, but they have what's known as grade 1 iron deficiency or early stage iron deficiency, where there's no anemia, the red blood cell count hasn't dropped yet, but their iron levels are low enough to start to produce a constellation of symptoms. And this is often missed in sort of the annual physical exam and when looking at blood tests. And so it's because women lose blood during menstrual flow during their childbearing years, they often lose a fair bit of iron and they don't replace it quickly enough. And so they get these symptoms. There's no anemia, but they get some of these classic symptoms where they get frequent colds or infections, and just as they recover for one, they get another one because their immune system is weak, because iron is required for immune function. Or they feel cold all the time because they have a reduced body temperature. Or they get more frequent headaches than usual. Or they have constant fatigue. They don't have the energy to go to the gym and work out. They'd love to get a workout in, but they don't have the energy. Or they start working out, then they get really tired, or they get sick. And they say, I'm getting sick and tired. Every time I go to the gym, I just get sick and tired. Why am I trying to work out? Classic symptoms of iron deficiency. Also, if a person is a little bit prone to depression or, seasonal affective disorder, they'll feel more depressed because the brain needs iron as well, so it can trigger or aggravate even bouts of depression. So how do you know if you have stage 1 iron deficiency? Well, it's usually a blood level of serum ferritin between 12 and 20 micrograms per liter. Now, if the level is below 12, you're probably going to show up with anemia, and that's serious. That requires a prescription iron medication. But for women who are in that gray area between 12 and 20 micrograms per liter of serum ferritin, that's where nutritional support comes in really handy to get you out of that grade 1 level and up beyond into the more ideal range, so you don't have these grade 1 iron deficiency symptoms. So again, in grade 1, you don't have the anemia. So sometimes doctors look at your blood panel and go, oh, you're not anemic, you're doing fine. But if the serum ferritin is below 20, very often some of these constellation of symptoms will occur, and you can try everything else under the sun, but you can't shake it till you get your iron levels a little higher. So it's one of those things that's often missed in the general annual physical exam workup. So because it's so prevalent, click on the link below, read my short review article on this subject. It explains all the signs and symptoms, it explains what blood tests you should have your doctor do in case you're having some of these symptoms, and how to safely get your iron back into the more optimal range. Now, at MeschinoHealth.com, you'll see my other research review papers, you'll see footage from my live professional seminars, other downloads, resources, and videos I've created. They're all there to help you lead a long, healthy, functional life. All my research review papers and teaching materials are complete with all the scientific references, so you'll see you're getting only evidence-based information from me on any health topic that you're looking for. So you should use MeschinoHealth.com as an ongoing, reliable resource of health and wellness information for both you and your family. Thanks so much for watching.